Did you know that after age 70, some medical checkups may actually create more problems than they solve? Studies suggest that certain routine tests, once helpful at a younger age, can become risky as our bodies change. The very scans and screenings meant to keep us safe may sometimes lead to unnecessary anxiety, risky treatments, or even procedures we didn't need in the first place. That's why in today's video, we'll uncover 5 common health checkups seniors should think twice about after 70. Each one may sound familiar, but you'll see how, without the right questions, they can quietly cause more harm than help. And here's the most surprising part. The number 1 checkup on our list is still heavily promoted in many clinics, yet it carries risks that most older adults are never warned about. You'll want to hear that one before you schedule your next appointment. So whenever your doctor recommends a test, remember to ask this simple but powerful question. Will this test change my treatment now? Sometimes, that one question can save you a world of stress. If you're over 70, or if you care for a parent, partner, or loved one who is, this video is for you. We're going to talk about 5 routine health checkups that sound safe, even protective, but after a certain age they can bring more risk than reward. Now, let me be clear. This video is not medical advice, and every decision should be made with your doctor. But what I'll share with you today is grounded in research, clinical guidelines, and the experiences of thousands of older adults who have been through these tests themselves. By the end, you'll know exactly which screenings to question, what hidden risks they may carry, and what safer alternatives you can discuss with your healthcare provider. Most importantly, you'll learn the right questions to ask so you can stay in control of your health and avoid unnecessary stress. Before we get started, I'd love to know more about you. Please take a moment to share your age and the city or country you're watching from in the comments. Your stories and experiences help others feel less alone, and together, we build a community of wisdom in old age. Now let's begin. Before we dive into the list, let's make something clear. Not all testing is bad, but there's a difference between screening and diagnosis. Screening means testing when you feel fine, just in case. Diagnosis means checking when there are clear warning signs. If you notice sudden weight loss, unexplained bleeding, severe new headaches, or sudden neurological changes like slurred speech or weakness, testing is essential and can save lives. But routine, broad testing without symptoms often leads to false alarms, stress, and even risky procedures. Knowing the difference helps you stay safe. Number 5. Bone density scans, also known as a DEXA scan. But here's the question, are they always needed after 70? A DEXA scan measures the strength of your bones, looking for signs of thinning or osteoporosis. It's a useful tool, especially for women after menopause or anyone with a history of fractures. But it's important to know that some age-related bone loss is completely normal. Not every slight dip in density means you're destined for broken bones. Here's where caution comes in. Sometimes doctors jump straight to medications called bisphosphonates. Yes, these can help protect bone, but they're not without risks. Long-term use has been linked to jaw problems, unusual thigh fractures, and digestive issues. That's why the decision to start medication should never be automatic. It should be thoughtful. So what else can you do? The truth is, lifestyle habits play a huge role in bone health, and for many seniors with only mild bone loss, these may be enough. Let's start with vitamin D. Getting safe sun exposure or a supplement, if your levels are low, can make a big difference. Then there's exercise. Weight-bearing movements, like brisk walking, dancing, or climbing stairs, signal your bones to stay strong. Add in resistance training with light weights or resistance bands, and you're not just protecting bone, but also muscle strength and balance. That means fewer falls and fewer fractures. And don't forget nutrition. Calcium-rich foods like yogurt, leafy greens, or fortified milk feed your bones daily. It's not about loading up on supplements. It's about consistent, balanced intake. Here's a smart question to ask your doctor. If my DEXA scan shows only mild bone loss, what non-drug options should we try first? This puts you in control and helps avoid unnecessary medications when lifestyle can do the heavy lifting. So yes, a bone density scan can be valuable. But it's not just about the numbers. It's about your overall strength, balance, and habits. Think of it as one piece of the puzzle, important, but not the whole story. Number 4. Routine brain MRIs. Why do they often cause more worry than help? It's natural to feel alarmed when memory slips start showing up. A misplaced key, a forgotten name. Many older adults worry this means dementia. But here's the thing. Ordering an MRI right away is rarely the best first step. Why? Because as we age, the brain changes in ways that are completely expected. An MRI may show white matter changes, tiny vessel spots, or mild shrinkage. These sound scary on paper, but for most people over 70, they're a normal part of aging, not necessarily a disease. Unfortunately, once these findings appear in black and white, anxiety skyrockets. Patients begin to imagine the worst, and sometimes this leads to a cascade of further tests, referrals, and even medications that don't truly help. So what's the smarter first step? For mild memory complaints, doctors usually begin with cognitive screening. Simple memory and attention tests done in the office can give a clearer picture of whether the changes are within normal range or point to something more. Alongside this, lifestyle adjustments can make a big impact. Better sleep, regular exercise, managing blood pressure and blood sugar, staying mentally active, and keeping strong social connections. These habits do more for long-term brain health than any early MRI. That doesn't mean brain scans are never useful. If symptoms are severe, rapidly worsening, or come with other warning signs, like sudden personality change, difficulty speaking, or balance problems, then an MRI may be absolutely necessary. But for everyday forgetfulness, the scan usually doesn't change what doctors recommend. Here's a powerful question you can ask your doctor. Will an MRI change my immediate treatment? Or can we start with a cognitive test and lifestyle steps first? This keeps the focus on meaningful action, rather than unnecessary worry. So remember, an MRI can be a helpful tool at the right time, but using it too early can lead to more confusion than clarity. When it comes to mild memory changes, start with the basics: screening, lifestyle, and reassurance. Often that's exactly what's needed. Number 3, cardiac stress tests. If you're over 70 and don't have chest pain or other symptoms, this test may cause more problems than it solves. Stress tests, often done on a treadmill with ECG monitoring, are designed to uncover hidden heart disease. But here's the catch. In older adults without symptoms, these tests carry a high false positive rate. That means the test can suggest a problem even when your heart is functioning normally. And once a stress test raises suspicion, what usually happens next? More testing. Many seniors end up going through angiograms, CT scans, or even invasive procedures like cardiac catheterization, all of which carry their own risks, including bleeding, kidney damage from contrast dye, or unnecessary stents. In other words, one misleading stress test can set off a domino effect of anxiety, expense, and real physical harm. So, when is a stress test actually useful? If you're experiencing classic heart disease symptoms, like chest pain on exertion, shortness of breath that worsens with activity, or unexplained fatigue, then it can be very helpful. But if you're completely asymptomatic, doctors often recommend simpler, safer alternatives first. For example, a resting ECG can provide a baseline of your heart rhythm without the added stress. Another option is a coronary calcium scan, which uses a quick, non-invasive CT to measure plaque buildup in the arteries. And sometimes, the most powerful tool is simply a careful medical history, your doctor asking, "What exactly are you feeling and when?" Here's a key question you should bring to your appointment. Are my symptoms classic for heart disease? Or should we try simpler tests first? This helps your doctor decide whether a treadmill stress test will actually guide treatment, or just create unnecessary worry. Bottom line? Stress tests are valuable in the right situation, but for older adults with no symptoms, they can do more harm than good. The goal is not to test for the sake of testing. It's to choose the test that truly adds value to your health and peace of mind. Number 2, routine colonoscopy. While this test has saved many lives through early cancer detection, after age 70, especially beyond 75, the risks often outweigh the benefits. Let's start with what colonoscopy involves. Preparation usually means drinking large volumes of strong laxatives to clear the bowel. For older adults, this prep alone can be challenging. It can cause dehydration, dizziness, or even kidney strain. Then there's the procedure itself, which requires sedation or anesthesia. While younger people usually tolerate it well, seniors face higher risks of complications such as low blood pressure, irregular heart rhythms, or breathing difficulties during sedation. The most concerning complication, though rare, is colon perforation, a tear in the bowel wall. While this happens in less than 1% of procedures, the chance rises with age and frailty. Recovery from such a complication can be especially difficult for someone in their 70s or 80s. Guidelines reflect this reality. Many expert groups, including the U.S. Preventive Services Task Force, suggest stopping routine colon cancer screening around age 75, especially if prior colonoscopies have been clear. Why? Because colon cancers usually take many years to develop. If you've been regularly screened before 70, the likelihood of a new aggressive cancer appearing suddenly is relatively low. In those cases, the risks of colonoscopy may be greater than the potential benefit. So what are the safer alternatives? One widely recommended option is the FIT stool test, fecal immunochemical test. It's non-invasive, can be done at home, and checks for hidden blood in the stool, a possible sign of early cancer or polyps. While not as detailed as a colonoscopy, FIT testing is safe, repeatable every year, and can be a practical choice for seniors. Another approach is symptom-driven testing. Instead of routine colonoscopies, you and your doctor can agree to investigate only if concerning symptoms appear, such as rectal bleeding, unexplained anemia, or major changes in bowel habits. This way, you avoid unnecessary risks while still staying alert to red flags. Here's the key question to take with you. Given my age, my health, and my past screenings, is colonoscopy necessary, or can we use a stool test instead? This empowers your doctor to weigh your history and current condition, rather than defaulting to just one more scope. Bottom line? Colonoscopy is a powerful tool, but after a certain age, it can shift from life-saving to risk-heavy. If you're over 70, don't assume the same screening rules still apply. Instead, have a thoughtful conversation with your doctor about whether it's truly worth it, or whether a simple, safer alternative would be better for you. And finally, number 1 on our list, full-body CT scans, sometimes marketed as executive scans. These are often promoted as the ultimate peace of mind tool. Lie down in a machine, scan your entire body, and supposedly rule out hidden diseases. It sounds tempting, especially as we age and worry more about what might be going on inside us. But the truth is, full-body CT scans for healthy older adults may create far more harm than benefit. Let's start with the basics. A CT scan, or computed tomography scan, uses X-rays and advanced computer processing to create detailed images of your internal organs, tissues, and bones. When used properly, for example, to investigate real symptoms like chest pain, unexplained weight loss, or a suspicious lump, CT scans can save lives. They're excellent diagnostic tools when there's a clear reason to look, but a full-body CT scan is different. Instead of focusing on a specific area based on symptoms, it takes a sweeping picture of everything, head to toe, in someone who feels perfectly fine. That's where the problems begin. First, there's the issue of radiation exposure. A single CT scan can expose you to a dose of radiation dozens or even hundreds of times greater than a simple chest X-ray. For younger people, that may slightly raise lifetime cancer risk. For older adults, the risk is still present, and because cumulative exposure matters, multiple scans over time can add up. In short, you're getting a significant dose of radiation without a clear medical need. Second, and perhaps more importantly, there's the problem of incidental findings. When you scan the entire body of a person who feels fine, you almost always find something. A tiny lung nodule, a harmless kidney cyst, a shadow on the liver, a slightly enlarged lymph node. In medical terms, many of these are benign, meaning they'll never cause harm. But once they're spotted, it's almost impossible to unsee them. This is where the cascade begins. A small nodule leads to a follow-up scan. That follow-up may lead to a biopsy. The biopsy, though often safe, carries risks: bleeding, infection, anxiety. And in some cases, the next step may be surgery, with all its risks of anesthesia, complications, and recovery. All of this may be triggered by a finding that never would have caused problems in your lifetime. Researchers call this the overdiagnosis problem. Studies suggest that full-body screening scans detect many abnormalities, but most of them are clinically insignificant. They don't extend life. In fact, they can shorten quality of life by creating unnecessary worry, procedures, and sometimes harmful treatments. Another important point. There's no strong evidence that full-body CT scans in healthy people improve survival. Major medical organizations, including the American College of Radiology, do not recommend whole-body scans for people without symptoms. Insurance typically doesn't cover them, which is why they're often sold as executive packages, expensive out-of-pocket services that may provide reassurance but not real health benefit. So what's the safer approach? Instead of scanning everything in hopes of catching a rare hidden problem, the better strategy is targeted imaging guided by symptoms and medical history. For example, if you have chest pain with exertion, a CT angiogram may be appropriate. If you have blood in the urine, a CT of the urinary tract could be useful. The key is that the test should be driven by a specific concern, not by curiosity or fear. In addition, many age-related concerns can be addressed with non-imaging approaches first. Regular checkups, simple blood tests, blood pressure monitoring, and lifestyle adjustments like exercise, diet, and sleep. These are lower risk and often more impactful than a reassurance scan. Here's a practical question you can take to your doctor before agreeing to a scan. If this test finds a small nodule, what would be the realistic next steps? What are the risks of intervention versus just monitoring it over time? Asking this helps you understand whether the scan could lock you into a cycle of procedures that may not improve your health. Let's be clear, CT scans have their place. They're life-saving when used appropriately. But as a blanket screening tool for seniors who feel well, they can do more harm than good. They may expose you to radiation, start a chain of unnecessary procedures, and drain time and energy that could be better spent living life. So the bottom line is this. Full-body CT scans aren't a shortcut to peace of mind. They're often a fast track to unnecessary worry. If you're healthy and over 70, think twice before signing up for an executive scan package. Instead, focus on regular doctor visits, evidence-based screenings, and listening to your body's signals. That way, you'll be protecting not just your health, but also your independence and peace of mind. So if certain tests can do more harm than good, what should you focus on instead? The answer is practical prevention, small, steady steps that protect your health without unnecessary risks. First, strength and balance exercises. Even simple daily routines like walking, gentle squats, or practicing single-leg stands can reduce falls, improve mobility, and keep you independent longer. Second, medication review. As we age, prescriptions pile up. Some may interact or no longer be necessary. A yearly review with your doctor or pharmacist can cut side effects and protect your health. Third, nutrition. Prioritize foods rich in protein, calcium, and healthy fats. Think fish, beans, leafy greens, nuts, and colorful fruits. Pair this with enough hydration throughout the day. Fourth, sleep. Deep, regular rest supports memory, mood, and even immune function. Avoid heavy late meals, caffeine in the evening, and keep a calm bedtime routine. Fifth, vaccinations. Flu, pneumonia, shingles, and COVID boosters remain vital tools for reducing serious illness. And finally, routine primary care checks. A trusted doctor who knows your history can often spot issues early, without over-testing. These practical steps protect you more effectively than unnecessary scans ever could. Let's quickly recap the 5 tests you should think twice about after 70. Number 5, bone density scans. Mild bone loss is normal with age, and over-treatment can bring more risk than benefit. Number 4, brain MRIs for mild memory slips. Most age-related changes look scary on a scan, but don't require urgent action. Start with cognitive checks and lifestyle steps first. Number 3, cardiac stress tests when you don't have symptoms. False positives are common in seniors and can lead to risky follow-ups. Simpler tests may be safer. Number 2, routine colonoscopies. After age 75, the risks from sedation and perforation often outweigh benefits, especially if past screenings were clear. And number 1, full-body CT scans. These carry radiation risks and often spark a cascade of unnecessary biopsies or surgeries. So how can you stay safe? Before agreeing to any test, ask your doctor 3 simple questions. Will this test change my treatment right now? What are the risks of follow-up if something is found? Is there a safer alternative for someone my age? These questions put you back in control, helping you avoid harm and focus on what truly matters for your health. Growing older doesn't mean giving up control. It means being wiser about your choices. Avoiding unnecessary tests is one way to protect both your health and peace of mind. Start small. At your next appointment, ask one of the 3 key questions we covered today. That single step can shift the conversation towards safer, smarter care. Now, I'd love to hear from you. Have you ever turned down a test your doctor suggested? Share your story in the comments. It may help someone else. And don't forget to like, subscribe, and join us here at Wisdom in Old Age.